Welcome back to Face the Nation. We are back now with more from the former head of the FDA, Dr. Scott Gottlieb, and then we will take a look at the economic impact of the coronavirus crisis as lives across this country have changed in the course of this week. Doctor, we were talking about hospitals being basically able to help people if they get the virus or anything else. Are they going to be overwhelmed? We are starting to see things like pictures of tents set up outside of hospitals. Is that something other hospitals should be doing, either isolating or changing triage, or is this about simply not having enough beds?
Well, hospitals have emergency protocols, and they're implementing those right now, and that's very prudent. Trying to build facilities to offload some of the capacity from the hospital onto other sites so the ERs don't get overrun. We have about 1 million hospital beds in this country, about 100,000 are critical care beds, 50,000 of those are medical intensive care unit beds. At any one time, most of those ICU beds are filled, and hospitals are about 70% occupied. So we don't have a lot of excess capacity. We also don't have a lot of capacity with excess respirators. There's about 60,000 full-featured respirators in the country, about 8,900 in stockpile. So if we do have multiple epidemics in multiple large U.S. cities, the system will become overwhelmed. I think we can handle a Wuhan in one major U.S. city and pulse resources into that. What I worry about, again, is multiple cities having that kind of an outbreak. Because
if you don't have enough ventilators or other equipment, doctors have to start making choices about who gets what.
Unfortunately, there's about 100,000 other ventilators that aren't full-featured ventilators but could be used in a pinch. And so what we need to do is try to free up capacity right now, and that's what you see hospitals doing. That's what they're doing with these tents and these surge facilities. They need to start discharging patients where they can, not doing elective procedures, so they're not bringing in patients. These are hard economic decisions for the hospitals, but this is absolutely what they have to be doing. And we have time to do it. We do have 3 or 4 weeks if we're going to be on that trajectory that China was on to build that surge capacity right now. China did just about everything wrong leading into their lockdown, and they still were able to get control of their epidemic there. We do have an opportunity now, but every day counts. Every day matters. Is the White House listening to you? The president mentioned you by name this week. Look, I've been fortunate to have the opportunity to talk to officials in the White House all through this. Some of the calls that I was making to them, the conversations I was having go back to January. They've been on top of this. I mean, they've been concerned about this. I've been talking to White House staff, and the staff's been concerned about this. And so I'm going to continue to try to provide whatever help I can.
All right, Dr. Gottlieb, thank you.
Thanks a lot.
Good to have you with us once again.